Welcome to our channel. Today we're tackling a sensitive issue, problematic sexual behaviors. Many people worry about their sexual behavior feeling out of control. This video offers a compassionate and science-backed guide to navigating these situations. Our goal is to provide you with valuable insights and resources. Whether you're personally affected or want to support someone else, this video is for you. It's time to break the silence surrounding problematic sexual behaviors. Join us as we shed light on this complex and often misunderstood aspect of human experience. Before diving into specifics, let's acknowledge the human element. Understanding problematic sexual behaviors requires empathy and sensitivity. It's crucial to approach them with compassion and without judgment. Behind every struggle with sexual behavior is a unique individual deserving of respect and understanding. By choosing empathy, we create a more conducive environment for learning and growth. Let's approach this topic with open hearts and minds, remembering that everyone deserves compassion and care. Human sexuality is incredibly diverse. What's considered normal varies dramatically from person to person. Attempting to fit everyone into a narrow definition of normal is harmful. Embracing the diversity of sexual expression is essential for promoting sexual health and well-being. Let's celebrate the richness and complexity of human sexual expression. Our understanding of normal sexual behavior is often shaped by cultural and societal norms. These norms can vary significantly across different cultures, religions, and time periods. When exploring problematic sexual behaviors, we must be mindful of our own biases. Self-reflection and a willingness to challenge our preconceived notions are essential. By being aware of our own biases, we can create a more inclusive and compassionate space for discussing sexual health. Individuals within a relationship may have different preferences or comfort levels. Open and honest communication about sex is vital for a healthy and fulfilling sexual relationship. This requires creating a space of mutual respect, trust, and non-judgment. When partners feel comfortable communicating openly about sex, they're better equipped to navigate differences and build a stronger connection. Honest and respectful dialogue about sex is crucial for any relationship. Defining problematic sexual behavior is far from straightforward. It's not simply about frequency or specific acts. Context, individual experiences, and potential harm all play a role. There's no universal standard for what's considered normal or acceptable sexual behavior. Cultural norms, personal values, and individual differences all contribute to the complexity. We need a nuanced understanding that takes into account the individual, their relationships, and the potential consequences of their behaviors. This requires careful consideration and often professional guidance. It's essential to approach these conversations with sensitivity, avoiding judgment and seeking to understand the complexities involved. The term compulsive sexual behavior disorder, CSBD, has emerged as a potential diagnosis for some individuals struggling with their sexual behavior. It's characterized by persistent, intense sexual urges or impulses that feel uncontrollable, leading to repetitive behaviors, causing distress or impairment. The CSBD diagnosis remains controversial within the medical and psychological communities. The debate highlights the complexity of defining and diagnosing problematic sexual behavior. A comprehensive assessment that considers all contributing factors is essential for determining the most appropriate course of action. When determining if sexual behavior is problematic, focus on three key indicators: distress, impairment, and consent. Distress. Is the individual experiencing significant emotional distress related to their sexual behaviors? Impairment. Are these behaviors interfering with their daily life, relationships, or overall well-being? Consent. Are all sexual activities consensual and respectful of all parties involved? If an individual's sexual behavior is causing significant distress or impairment, or if it involves non-consensual acts, it's essential to seek professional help. Problematic sexual behavior isn't about judging someone's desires or choices, but recognizing when those behaviors are causing harm. Determining the exact prevalence of problematic sexual behaviors, including CSBD, is challenging. The sensitive nature of the topic often leads to underreporting and stigma. Existing research relies heavily on self-reported surveys, which can be influenced by factors like shame and social desirability bias. Studies attempting to estimate prevalence have yielded a wide range of results. The lack of a clear consensus on prevalence underscores the need for more rigorous research. Despite the challenges in measurement, it's clear that problematic sexual behaviors are not uncommon. Problematic sexual behaviors rarely exist in isolation. Research shows a strong link between these behaviors and other mental health conditions, often referred to as comorbidities. Individuals struggling with their sexual behavior may also be dealing with depression, anxiety, trauma, substance abuse, or personality disorders. It's crucial to identify any underlying conditions that may be contributing to the behavior. Treating problematic sexual behaviors effectively often requires a multifaceted approach that addresses both the behaviors themselves and any co-occurring mental health conditions. This might involve a combination of therapy, medication, support groups, and lifestyle changes tailored to the individual's unique needs. When exploring the relationship between problematic sexual behaviors and comorbidities, it's essential to remember that correlation doesn't equal causation. While these issues often co-occur, it's not always clear which one is the root cause. Effective treatment requires a holistic approach that considers the individual's entire mental and emotional landscape. By addressing the root causes of problematic sexual behaviors, individuals can begin to heal and develop healthier coping mechanisms. This often involves a combination of self-exploration, therapy, and support from qualified professionals. Understanding the interconnectedness of these issues is critical for developing personalized treatment plans. In today's digital age, it's impossible to discuss problematic sexual behaviors without addressing the role of pornography and sexually explicit media. Research on the effects of pornography is complex and often contradictory. Some studies suggest potential links between pornography use and negative outcomes, such as increased risk-taking in sexual behavior or dissatisfaction in relationships. However, it's crucial to interpret these findings with caution, as correlation does not equal causation. For many individuals, pornography use is a normal part of their sexual expression and doesn't lead to any negative consequences. Understanding the role of pornography in problematic sexual behaviors requires a nuanced and individualized approach. Rather than focusing on whether pornography is inherently good or bad, it's more helpful to understand the nuances of how it can impact individuals differently. The effects of pornography depend on various factors, including frequency and context of use. People with pre-existing mental health conditions may be more susceptible to experiencing negative consequences from pornography use. If someone is concerned about their pornography use or its impact on their life, seeking professional help from a therapist specializing in sexual health can be beneficial. By moving beyond simplistic judgments and focusing on the specific context, content, and individual experiences, we can better address potential concerns. Promoting healthy sexual expression in the digital age requires a nuanced and individualized approach. One of the most significant obstacles in addressing problematic sexual behaviors is the pervasive sense of shame that often surrounds these issues. Societal taboos, religious beliefs, and cultural norms can create a climate where individuals feel ashamed or afraid to talk openly about their sexual desires and struggles. This shame can be incredibly isolating and prevent people from seeking the help they need. The weight of this silence can be incredibly heavy, preventing individuals from accessing support, education, and treatment options. By bringing these conversations into the light, we can begin to dismantle the stigma surrounding problematic sexual behaviors. Seeking support from trusted individuals can provide a safe and non-judgmental space to process these emotions and begin the journey toward healing. Addressing the impact of shame and stigma requires a collective effort to shift societal attitudes. We need to move away from judgment and create a culture of compassion and open dialogue. This starts with challenging our own biases about sexuality. Approach these issues with empathy, recognizing deeper emotional struggles or mental health conditions. Educate ourselves, challenge stigmatizing language, and advocate for supportive policies. Treat individuals with respect and understanding to create space for help without fear. Foster a culture of compassion and open communication to empower individuals. If you're struggling with problematic sexual behaviors, remember that you're not alone. Seeking help is a sign of strength and a commitment to your well-being. Reach out to a trusted healthcare professional, a therapist specializing in sexual health, or a counselor experienced in addiction. They can provide a safe space to discuss your concerns and guide you toward appropriate resources. Remember, you don't have to navigate this journey alone. Support groups offer community and shared experience. Connecting with others can be validating and empowering. Confide in a trusted friend, family member, or spiritual advisor. Having someone to talk to who listens without judgment can make a world of difference. Seeking help is a sign of courage, not weakness. By taking that first step, you're embarking on a path towards healing and a more fulfilling life. Treating problematic sexual behaviors often involves a multifaceted approach tailored to the individual's unique needs, experiences, and goals. There's no one-size-fits-all solution, and the most effective treatment plans typically address both the behaviors themselves and any underlying mental health conditions or contributing factors. Psychotherapy, particularly cognitive behavioral therapy, is often a cornerstone of treatment. CBT helps individuals identify and modify negative thought patterns and behavioral triggers that contribute to their compulsive behaviors. It also equips them with coping mechanisms and relapse prevention strategies to manage urges and make healthier choices. In addition to individual therapy, couples or family therapy can be incredibly beneficial, particularly if the problematic behaviors are impacting relationships. These sessions provide a safe and structured environment to address relationship dynamics, improve communication, rebuild trust, and establish healthier boundaries. Medication may also be considered as part of a comprehensive treatment plan, especially if co-occurring mental health conditions like depression, anxiety, or obsessive-compulsive disorder are present. Medications can help manage these underlying conditions, reducing their impact on sexual behaviors. It's essential to remember that finding the right treatment approach may take time and experimentation. Be patient with yourself, communicate openly with your healthcare providers, and be willing to adjust your treatment plan as needed to find what works best for you. Recovering from problematic sexual behaviors is an ongoing journey. Embrace ongoing support and self-care to maintain progress and navigate challenges. Regular support group meetings provide community, accountability, and encouragement. Connecting with others reminds you that you're not alone. Regular self-care is crucial for emotional and mental well-being. Activities like exercise, mindfulness, and hobbies support recovery. Be kind and compassionate with yourself. Setbacks are normal. See them as opportunities for growth. Celebrate successes and practice self-forgiveness. Embrace support, self-care, and self-compassion for a fulfilling recovery journey. In this exploration of problematic sexual behaviors, we've journeyed through complex and sensitive territory. We've confronted the challenges of defining normal sexual expression, recognizing that diversity is inherent to human sexuality. We've delved into the controversial diagnosis of CSBD, acknowledging its complexities and the ongoing debate surrounding its validity. We've explored the prevalence of these issues, recognizing that accurate measurement is hindered by shame and stigma. We've examined the interconnectedness of problematic sexual behaviors with other mental health conditions, emphasizing the need for a holistic approach to treatment. We've navigated the controversial landscape of pornography's influence, advocating for nuanced understanding and individualized assessments. Above all, we've emphasized the importance of empathy, compassion, and a non-judgmental approach when addressing these sensitive issues. Shame thrives in silence. By fostering open dialogue, challenging societal stigmas, and creating a culture of support, we can empower individuals to seek help without fear of judgment or rejection. Remember, if you're struggling with problematic sexual behaviors, you are not alone. Reaching out for help is a sign of strength, and recovery is possible. With the right support, self-compassion, and a commitment to healing, you can navigate this journey and create a healthier, more fulfilling life for yourself. Please like and subscribe for more content.